Good afternoon. Thank you for joining us during these very trying times. I appreciate all the participants who tuned in today. My name is May Thamer, and I'm the lead on a project that's funded by PCORI to disseminate findings from several large recently completed research studies that are related to dialysis care. Welcome to our webinar presentation today for ESRD staff entitled Implementation of a Peer Mentoring Program for Patients with CKD and Their Caregivers. Please let me introduce today's speakers. First, Dr. Nasr Ghahramani from Penn State College of Medicine in Hershey, Pennsylvania. Dr. Ghahramani grew up outside Philadelphia, but he returned to Iran for medical school, where he finished his residency and fellowship. And after being allowed to leave the country, he obtained a research fellowship in nephrology at Yale, and later he did an internship at Vanderbilt, and now he is currently the professor of medicine and public health sciences, chief of nephrology, and the medical director of the kidney transplant program at Penn State. Our second speaker, Robin Asix, has been a renal social worker for over 20 years. She has a PA license and she's nephrology certified. She works with people affected by kidney disease, and she's inspired by them every day. Robin is also a faculty member with the University of New England. Third speaker is Christy Wassinger. She's a CRNP, and she's worked at Nephrology Associates of Central Pennsylvania for 10 years. She provides care to patients with CKD and also patients with ESRD that are on dialysis. Christy's a board member of the Kidney Foundation of Central Pennsylvania, and she's a committee member for the Patient and Family Partner Program Steering Committee, and we're going to talk about that a little bit in the presentation today. She feels that her patients have benefited over the years from the Patient and Family Partner Program, and she'd love to see this program continue to grow. Attending this webinar, one continuing education credits available to all nurse and social work attendees who pre-registered. And if you're only joining by phone, and I see some of you are, please send your phone number to Heather Sesso at HCECIL@qualityinsights.org so that she can verify your attendance for the continuing e-credits. The continuing education forms will be emailed to each attendee who meets the pre-registration and attendance requirements within a month of this event, and we will use the email address that you provided during registration. Finally, please post any questions you have during the presentation using the Q&A icon at the bottom, and we'll try to answer as many as possible at the end. So please let me now turn it over to Dr. Ghahramani.
Thank you very much, Dr. Thamer, for the introduction and for organizing the webinar, and good afternoon to everyone. Christy, Robin, and I appreciate the opportunity to present an overview of the practical aspects of implementing a peer mentoring program for patients with chronic kidney disease and their caregivers. These are the general topic areas and themes that we'll be discussing over the next 45 minutes. Hopefully, we'll be able to demonstrate how to set up a peer mentoring program at the dialysis facility level, how to train both patients and caregiver mentors, provide an overview of a training guide for peer mentors, describe the roles and responsibilities of individuals involved in the peer mentoring program, and towards the end, review some potential barriers and strategies to minimize the impact of those barriers in developing a peer mentoring program. The peer mentoring program by the Kidney Foundation of Central Pennsylvania had been operational several years before my involvement, particularly my involvement as the principal investigator of a PCORI-funded research study. When we launched the study, we decided to conduct focus groups to help us better understand several questions from the perspective of patients and caregivers. Some areas we explored included characteristics of a good mentor, topics that should be included in the mentoring process, and topics to be included in the mentor training curriculum. These are some quotes from the focus groups of mentors as related to their perception of the characteristics of a good mentor, perceptions of the mentees in regards to characteristics of a good mentor. And as you see, several themes stand out which have been underlined. And I have summarized them in this slide. A caring mentor was characterized as considerate and as someone who would go out of his or her way for the good of the mentee. A good listener was characterized by the willingness to devote full attention and as one who tries to understand the mentee's question and the mentee's problem and not necessarily focused on answering the question or solving the problem. A relatable mentor was someone who found commonalities with the mentee. A good mentor is understanding and shares information honestly. So those were some characteristics of a good mentor that came out of the mentee focus groups. The focus groups also discussed topics to be included in the mentorship. One of the major themes that was felt to be important in the mentoring relationship was setting ground rules and boundaries. For example, the mentee should be made aware at the beginning of the mentoring relationship not to seek or expect medical advice from the mentor. Other ground rules involved mutual respect for privacy and confidentiality, and also times and modes of contact. The focus groups also suggested identification of resources to be included in the mentoring discussions. For example, who to contact with questions about insurance or how to go about learning about various types of dialysis. Other suggested topics included discussion of coping skills to minimize risk of being overwhelmed and means of staying well organized. And also encouraging the mentees to be actively involved in their own care by emphasizing the patient's own responsibility and their role as key members of the healthcare team. And finally, reiterating the role of family and friends as members of the support structure. From the very beginning, the founders of the peer mentoring program, the Patient Family Partner Program, realized that if this program was to achieve its goals of engaging patients and caregivers, formal and standardized training of the mentors was essential. They wanted to set this aside, sort of separate it from a peer support group and have a formal training program for the mentors. They also realized that it was important to regularly review the goals, the objectives, and the implementation process of the program. The training consists of 12 hours of didactic presentations. Each group consists of 7 to 9 mentor candidates, an instructor, and the program coordinator. They meet for 6 weekly 2-hour sessions, and the instructors are volunteer professionals who guide the interactive sessions. The candidates have access to the print versions of the slide set. And this is the list of the topics, and in the second column you see the contents covered in each session, and then the third column has the instructors for each of the sessions, and you see that the instructors come from various backgrounds. So with that, I'll now ask Robin and Christy to comment on the training and the curriculum.
Hi, this is Christy Washinger. Over the last year, we have recently updated the manual to include the most up-to-date information, and it was reviewed by many renal professionals and an editor. At the end of each chapter, there also is a quiz to assess for learning, and during the class, there also is an additional presentation that's done by a renal professional. So the mentors are able to read the information in the booklet, do the quiz, also hear the information from a renal professional with a PowerPoint as well. There's time allowed during the classes for any questions and answers, and there also are activities during the classes, like different role plays and other ways to reinforce the materials. We recently were also able to get the manual into an audio format for our patients that may have sight disabilities or have issues with dyslexia or other illnesses of that such. And the one thing I want to add, this is Robin, is having different professionals come and present really bolsters professionals' investment in the renal community, and it really allows a more informal opportunity for the participants to ask questions in a comfortable setting. I was pretty skeptical, even as a social worker, about the attendance. I had thought many people were on dialysis or on home dialysis, and to ask them to do 12 hours of training over a 6-week period would be a barrier, but it really hasn't shown to be one. The people that attend have given such positive feedback. You know, they've shared that it almost becomes like a mini support group. They really form friendships, and that's a nice secondary gain from it, which isn't anything that we had anticipated. But I know a lot of them have exchanged numbers and stay friends and check in with each other. We also have refresher courses twice a year for those people who are trained so that they can come back and meet and chat about their experiences being a mentor. I do feel overall that increased knowledge helps them feel so empowered. And a lot of people also told me that when they did attend the classes, they were finally at a point in their illness or as a caregiver where they could really hear the information, that they had gotten information along the way and it was helpful, but they were really able to take it in and found it so helpful to them. Even many said, if I never mentor anyone, if I never get a mentee assigned, it's helpful for me regardless. Thank you.
Thank you very much, Christy and Robin. Evaluation of the mentors and feedback to the mentors have formed an important part of the process. Candidates anonymously evaluate each session. They receive homework to be completed prior to the next session, and then they receive feedback based on their responses to homework questions. At the beginning of each session, the coordinator reviews the evaluations from the previous sessions. So after 12 hours of training, the mentors attend the graduation ceremony and receive a certificate and are certified as certified partners or peer mentors. These certified mentors, as Robin mentioned, are required to attend at least one of 2 refresher courses per year, which are not just repetition of the previous didactic sessions, but they're discussions among mentors about their experience as mentors, and consist of a focused review of communication skills. After the mentors have completed the training, the program coordinator notifies the healthcare team, particularly the social worker, that their referred mentor candidates are now available for partnering with CKD patients or their caregivers. And once a mentee candidate is referred, the coordinator collaborates with the referring professional, usually the social worker, to identify the most appropriate match. Once the pairing has occurred, the mentor-mentee start their weekly phone calls and the monthly face-to-face contact at a mutually agreed upon location. Now, this is the traditional face-to-face mentorship that has been in effect since 2004 at the Kidney Foundation of Central Pennsylvania. With the study that we just completed, the PCORI-funded study that we just completed, in addition to the face-to-face peer mentoring, we also had an online peer mentoring arm. The online platform was specifically developed for the purpose of the study and had several features. Communication is through a password-protected patient private communication. Following the initial introductions, the mentor initiates the discussion thread by presenting an overview of the program. The pair reviews mutual goals and expectations at the time of the initial communication. The mentees then are able to update their status, which is only visible to the mentor and the coordinator. The mentor responds to any questions and, if needed, can attach documents for education. The mentees also have the option of using mood and symptom icons, such as seen here, to indicate their status at the time of posting. Longitudinally, this has the capacity for creation of a mood and symptom report for each of the mentees. The mentor sends a weekly reminder email asking the mentee to log on to the website and review any contents and to post a weekly action plan. In order to ensure that communication is appropriate and accurate, the coordinator monitors all the posts, and both parties are aware that the coordinator monitors the posts. In addition to posting mood and symptom icons, the mentee can also indicate their distress score, as seen here, to indicate the severity of their concerns. The mentor keeps a log of the communication that they've had with the mentee, and the coordinator regularly communicates with the mentee's care team, particularly with the social worker. I'd like to spend a few minutes to talk about the potential barriers to implementation and means to minimize their impact. I'll start with barriers from the point of view of the nephrologist. One of the most important barriers is that nephrologists might not consider peer mentoring as a reliable resource of information. And in the strict sense of the word, they're right. To alleviate that concern, they're reassured that mentors are trained and constantly reminded to avoid providing medical advice. Nephrologists might also be concerned that the program will interfere with the patient-provider relationship. In order to establish a bond and trust between the healthcare professionals and the patient-family partner program, one of the requirements of participation is that mentors and mentees are referred by their care team, meaning that the care team has essentially provided consent. Participants cannot self-refer. Also, many of the groups in the area, nephrology groups in the area, are involved in the patient-family partner program as instructors on a rotational basis and are familiar with the program. As such, they serve as advocates of the program within their own individual practices. And finally, nephrology practices might be concerned that trained mentors from different practices may attract mentees to their personal medical practices. To avoid that, for the most part, the mentor and mentee are selected from the same practice. In the event that the mentor and mentee need to be from different practices for any particular reason, both practices are made aware and they provide their permission. And with that, I'll ask Christy to comment on the barriers from a nephrology practice perspective.
Hi, this is Christy again. I think the barriers that were listed on the slide are the ones that I see in practice as well. I think when the program first started, there were many more barriers. I think there was a lot of fear about what kind of information was going to be given from the mentor to the mentee regarding medical advice or dietary advice or preference on nephrologist, transplant center, dialysis clinic, or modality. I think as the program has evolved, more providers, whether nephrologists, NPs, or PAs, are learning that this just is not the case of what the partnership is like, and that it is more of an emotional support, not for medical advice. During the training, we go over this many different times during the classes that they are not to give medical advice. And if they're asked to give medical advice, we try to have them redirect them to the dietitian if it's a dietary question, if it's a medical question to the nephrologist, so that is very clear from the get-go. As far as, I think other providers sometimes don't always understand what the training process is. And so I think getting more renal professionals involved as speakers has been quite helpful, because when they attend the class and learn more about the curriculum and the PowerPoints, they understand more what the mentors are being trained. So over the years, I've seen this lesson, and I've also seen that I think providers now are more willing to let patients be partnered with different groups, nephrology groups, and it has not been a problem recently at all. It's been improving.
Christy, thank you very much.
You're welcome.
Now let's turn to potential barriers from a social worker point of view. Social workers in general, and particularly the wonderful dialysis social workers, are inundated with all kinds of work, especially paperwork, on a daily basis. And the last thing that they might want to worry about is screening and referring patients and caregivers for a peer mentoring program. The Patient Family Partner Program has sort of reassured the social workers that much of the work will be done by the program. Social workers whose patients have participated in the program have indicated that their patients are more actively engaged in their own care and have had better outcomes. Also, social workers such as Robin, who have served as members of the curriculum committee, on the advisory board, or as instructors, have been the best ambassadors to the program. So speaking of wonderful social workers, I now turn to Robin Asik to share her perspective as a social worker.
Oh, thank you so much. I would say that it is so helpful to have social workers involved and share their experiences with other social workers. There were a lot of fears that if someone referred someone to the program, that they would have to then take on the tasks. And having a program coordinator in charge of that is very reassuring. And also, when we do ask social workers to volunteer and present, participate, or refer, making sure that they're well informed of what the program's about and what the process is has really been helpful. I have to say, a lot of the people, the social workers who have come and presented, they're like, I will happily come again. They have such a good experience and are really empowered by seeing the people in the classes learning and actively interested in all of the information, that it's a really fun experience. And that is something us social workers love to see, a positive thing for the people that we serve. I would say too that if a social worker is unsure, reaching out to the program coordinator or myself or another social worker to say, how are you explaining it? How do you invite a patient to, consider being a mentor or a mentee? And I have had people do that to say, can you share what you say to the people you work with? And that might make me feel more comfortable about it. So I think communication is key, and I appreciate the opportunity that we're able to present this today. Thank you.
Thanks, Robin. Finally, you obviously need buy-in from the participants, the patients and caregivers. Patients with end-stage renal disease deal with many health issues. Quite frequently, in addition to kidney disease, they're diabetic, have heart disease, vascular disease. They have issues with mobility, with transportation. And they might not be able to commit the time to complete mentor training and then be available as mentors. With help from professionals, the program selects individuals with a stable health status. And very early on, the level of commitment is clearly explained. And I must say, the program has been fairly successful in recruiting and retaining stable participants as mentor candidates, mentor trainees, and as mentors. Now that we've discussed the barriers, I would like to turn to the potential facilitators for successful implementation of a peer mentoring program. In our recruitment efforts, we've learned that the emphasis might need to shift towards identifying a local champion within each dialysis unit who educates patients and caregivers about the peer mentoring program. And this might very well be one of the patients in the unit or a caregiver. Most of our efforts have been focused on healthcare providers, but the patients and the caregivers might actually be excellent ambassadors. In regards to the actual operation, potential facilitators might be a patient advocacy organization, as was the Kidney Foundation of Central Pennsylvania in our case. Funding is obviously key, and philanthropic, charitable research agencies such as PCORI and healthcare organizations in the case of end-stage renal disease, particularly large dialysis organizations, might be facilitators. Several individuals and entities have played key roles in sustaining our peer mentoring program. The Community Advisory Board, the Kidney Foundation of Central Pennsylvania Board of Directors, has provided support and infrastructure. Robin and other social workers have been key contacts for recruitment. Dialysis nurses and dialysis practitioners such as Christy have been instrumental in helping us select the appropriate participants and have served as instructors and advisors for the program. Stakeholders have been involved in the project at the design, implementation, and dissemination stages. And this occurred even before the PCORI-funded study. The uniqueness of the Patient Family Partner Program was that it evolved naturally with input from numerous stakeholders even before PCORI actually existed, and the concept of involving patients in all aspects of research actually came to being. Lessons that we learned and would like to share include establishing trust with stakeholders early on by frequent meetings and providing updates, aligning our project with the goals of the stakeholder, in this case, a patient advocacy organization, recognizing key individuals, and you only need a few who will be your advocates, advisors, and ambassadors. Again, we were fortunate in that a program and an infrastructure was in existence before we undertook our study. But if we were to create a checklist of essential requirements for a peer mentoring program, these are a few items we would include. Organizational support. Ours was the Kidney Foundation of Central Pennsylvania. An infrastructure for recruitment and training of mentors, establishing and mentoring partnerships, periodic assessment and revision of the process and the program as needed. You can't really set in motion a program and let it be without periodically looking at its revision. And then promoting and marketing the program in various ways, and obviously funding. Before moving on to questions, I'll ask Robin and Christy for any closing comments.
First, yeah.
Hi, this is Christy. My closing comments would be that over the years, I've referred mentees and mentors to the program, and I've seen them both have improved quality of life. For the mentors, they feel that they have more knowledge, and they feel good helping someone else with kidney disease. They become more engaged in regards to their own disease, and they also start to volunteer for other opportunities. I've seen my patients become more involved with the renal community in regards to advocacy and volunteering. For my mentees, I think the biggest component is that they they realize that they're not alone. I think sometimes they feel like they're the only one that may be suffering with kidney disease or the only one that has a certain complication or problem. And I feel that they have some sort of comfort from knowing that they're not alone. And it also provides some emotional support, especially for patients that may not have a support system already in place. Thank you.
Thank you.
This is Robin. I had a few thoughts as well. One of the things I've seen is the benefit to the professionals in our clinic. When we have someone who becomes a mentor or a mentee who's matched, oftentimes they do become more engaged in their care and seem to be more interested in what's happening in regards to their health. And that is really helpful to me, at least as a professional. When people are engaged in their care, I become even more engaged in their care and well-being. And it's nice, it's more fun, it's better to work with them. Not that we don't work with everyone no matter what, but it is just a great benefit. Kidney disease is a catastrophic illness and it significantly impacts people and most parts of their lives, same with the caregivers. So it's really helpful to have a program and options to supplement what we're already trying to provide for them. And to have the face-to-face and a possible online option or an online platform can really make the difference in someone's lives. Kidney disease definitely doesn't really discriminate. You know, we have people as young as 19 at my clinic and as old as 92. And especially for those younger patients who really are more in tune to social media, having an online option is a wonderful tool for them. So I appreciate having this program to offer to people and help better their lives. Thank you.
Thank you both very much for your wonderful comments. Our next phase of our work at the Kidney Foundation of Central Pennsylvania with Patient Family Partner Program is to actually extend the online platform to include the smartphone app. Because as you're all aware, patients who are on dialysis sit in dialysis units in a chair or at home, and they usually have their phone by their side. And what better type of mentoring than actually mentoring at your chair side? So we thought that that's an opportunity for the patients to use the online platform rather than wait to go home and log onto the computer. So that's something that we're working on developing, and that's the next phase of our next implementation application to PCORI. With that, we have quite a bit of time for questions and answers. So please type in any questions that you have. I'd be happy to answer them.
Dr. Ghahramani, while we're waiting for folks to have some questions, and please send them in. I had a few in looking at your, listening to your presentation. You sort of touched on this, all three of you, but what do you think motivates someone to be a mentor? And do you find either that there's a scarcity of people who have the qualifications and the stable health conditions to be a mentor, or do you find that there are too many candidates and you have to winnow it down?
Robin, would you like to tackle that one?
Actually, I think Christy has some thoughts on it, but if I could turn it over to her.
So I think many patients with kidney disease, particularly those on dialysis, vividly recall how when they started a therapy, their fears and their concerns. And I think that they remember how sometimes it can be rough to start dialysis or rough to cope with their kidney disease. So a lot of times when I approach patients as becoming a mentor, because they remember how hard it was for them or what their challenges were, they want to help somebody else. They want somebody else not to have to go through that. And so many times patients do it just for that reason alone. And I think because when they've gotten through their journey and they feel like they're doing better, they just want to help somebody else. They want to just make it easier for somebody when they transition to dialysis or when they're having a hard time with their kidney disease.
That's a great point, Christy. And actually, the existence of the Patient Family Partner Program is essentially due to the exact same feeling that Christy mentioned by a patient who happened to be a nurse, Peggy Pierce, and who developed end-stage kidney disease because of polycystic kidneys, came from a very highly educated background, herself and her family, and realized that as she was going through sort of maneuvering the healthcare system as a patient with end-stage kidney disease, she was facing many challenges. And then she thought to herself, if me with my background have so much challenges, I'm facing so much challenges, how are others dealing with it? And that's how the whole idea of peer mentoring came about.
Well, do you think if it was to be implemented more broadly, that there would be a problem in identifying enough peer mentors?
In our area, and our area is fairly unique. It's overall a generous philanthropic part of Pennsylvania. People are willing to do things for others. In our area, we haven't really had that as a major problem. And thinking of pairing one mentor with several mentees, you really don't need a huge number of. So, and that's what we've been doing. It's not one-to-one pairing. That is not efficient and practical. And especially through the online platform, we'll have the ability to mentor to individuals in remote parts, in rural areas, and that will sort of multiply. And then people who are mentored are potential mentors themselves. So mentees
of course.
forward to be trained to be mentors, and it sets a chain reaction into effect.
Oh, that's interesting. Something that I don't think you all discussed is whether you felt that mentoring was most critical at initiation of dialysis, when a lot of the important decisions need to be made and a person is sort of getting accustomed to it, or is this something that you think is perhaps more critical after the rigors and the daily routine of dialysis sink in the next 6 months or at a year afterwards? What do you think in terms of the timing?
Christy and Robin?
I think it really varies. You know, my experience has been there's been some people who are new to dialysis and really want to connect with someone who's also on dialysis. Sometimes we'll have people who had been on, like, say, in-center hemodialysis and are curious about home dialysis, but want to talk to somebody who is already on home dialysis and what their perspective is. Sometimes things just happen. I have had people who've been on dialysis for years and they just start struggling for some reason and want a referral at that point. So when I first got involved with the program, I really thought it was going to be all people within like the first 3 months of starting treatment, but I have found it's quite a variety of times when people are interested in participating.
Okay, that's in terms of the type of the vehicle, the venue in which it occurs, do you find that there's a preference with online versus face-to-face versus phone in terms of the frequency? Have you found that the mentees have said, gosh, I wish we could see each other more frequently, or, you know, we don't need to meet once a month for the face-to-face, let's just do it online? Or is that relatively variable too? And is there flexibility for that?
So the online platform was developed for research purposes, and patients were randomly assigned to either face-to-face or online or no mentoring. However, when we did focus group studies, there were mixed feelings among the face-to-face and the online about the modality that they were in. So when we, so one of the conversation items that came out of the online focus group, the focus group of the online groups was that I would have preferred to see the person. And then within the same focus group, there was discussion that I felt like I was able to access my mentor more frequently because I knew that I wouldn't be imposing on their time, because it wasn't real time. So the online mentoring was not real time. So they felt that they weren't imposing on the mentor's time. Overall, I think there was really no uniform thought about which they would have preferred. But it was they were assigned to one modality. They didn't really have the choice.
Interesting. Do you generally match your mentor and mentee on dialysis modality as well? I know, I think was either Robin or Christy just said in that some cases when someone's thinking of switching, they'll want to get mentored by somebody who has another form of dialysis modality. But do you generally try to match that up?
Hi, this is Christy. I've recently been more involved with the matching process over the last year and a half, and it really depends on what is on the application. So when the referral comes in, on the application, it can say the social worker or the referral source can kind of put what the patient is looking for. So if it's a CKD stage 4 patient and they want to speak to somebody that has had a kidney transplant, then I would pair that patient with a transplanted patient. If they are on hemodialysis and they're just looking for additional emotional support, then we would pair them with hemodialysis so that they have similar, similar experiences and can kind of talk to each other. So it really depends on the referral and what the mentee is looking for from their mentor. So it's a very individualized approach when we match the mentees and the mentors.
Well, this is excellent. Thank you so much. I don't see any questions. Why don't we, unless someone sends one in right now. Again, thank you all, Dr. Ghahramani, Robin, Christy, for a really interesting presentation, and it makes it seem very much more doable. And what an excellent idea, and I hope peer mentoring is definitely implemented much more frequently. And I know if anybody has any follow-up questions, they can just either send me an email or send an email to everybody, to our presenters. When you exit this webinar, and we'll be concluding very shortly, you'll need to click on a continue button to take you to an evaluation form that will provide us with some valuable information for future webinars. And I thank you now for completing that evaluation form. And we'll be in touch with you to let you know about future webinars. We are now focusing on implementation of some of the dialysis studies that we presented to many of you last year. So have a wonderful rest of your day, and please stay safe. And again, thank you all for participating.
Thank you very much. Bye-bye.
Thank you.
Thank you. Thank you. I can hang up.